Do you constantly suffer from fungal infections? Ringworm? Athlete's foot? Foul balls? Don't worry, I can coach you through the awkward itch. Hi, I'm Amy Starling, a graduate student in the FNP track at Auburn University School of Nursing. Today we'll be discussing the imidazole class. The drug class includes 9 drugs, with the most popular drugs being ketoconazole, miconazole, and isaconazole. Topical imidazoles are not absorbed systemically, but oral imidazoles are highly variable individually. For example, ketoconazole requires an acidic gastric pH for optimal absorption. Absorption can be improved by administration with a Coca-Cola beverage and impaired by drugs that interfere with gastric acidification, such as omeprazole or ranitidine. Imidazoles alter permeability of the cell membrane and inhibit fungal synthesis of phospholipids, resulting in cell lysis, which facilitates the growth of normal cells and eradication of the fungus. Imidazoles should be used for susceptible systemic fungal infections, such as histoplasmosis, that have failed other therapies. Imidazoles are available as an oral formulation, a cream, gel, foam, and shampoo for topical use. Imidazoles commonly cause GI distress and headaches. Applied topically, severe irritation, pruritus, and stinging can occur. Imidazoles also cause severe liver injury that can result in hepatitis, which is why they should be monitored closely. They can also cause adrenal insufficiency through decreasing the body's production of glucocorticoids, and gynecomastia and irregular menstrual cycles are also common side effects. Imidazoles are a pregnancy category B and contraindicated in pregnant and breastfeeding women. They're also contraindicated in patients with liver disease. Imidazoles are well distributed into inflamed joint fluid, saliva, bile, urine, breast milk, sebum, feces, tendons, skin, and soft tissue. Only negligible amounts enter into the CSF fluid. Imidazole elimination is biphasic, with a half-life of 2 hours within the first 10 hours and 8 hours thereafter. Approximately 13% is excreted in the urine, and the majority is excreted via the biliary system. Watch out for significant drug reactions. One example of a significant drug reaction is the long QT syndrome. This happens when imidazoles are combined with drugs such as Haldol, a drug that already has a long QT. This occurs because the imidazoles delay drug metabolism, ultimately prolonging the QT interval. Another significant drug reaction is what happens when imidazoles and midazolam combine. You can have excessive sedation. Because of this, you want to prescribe lorazepam when you have patients on imidazoles. Lastly, our final severe drug interaction is that imidazoles inhibit the metabolism of statins, resulting in plasma concentration of statin drugs. This can inadvertently lead to rhabdomyolysis. Don't be caught in left field. Make sure that if you're prescribing an imidazole, to hold the statins. When monitoring for patients taking imidazoles, you also want to monitor for the efficacy of treatment and monitor the liver enzymes prior to treatment and monthly because of potential hepatotoxicity. Lastly, with imidazoles, we have to cover all our bases to make sure that our patients are educated. Patients need to know to take the drugs as prescribed for the full course of treatment, even after symptoms improve. When treating infants, pacifiers and nipples should be washed in warm soapy water and soaked for 20 minutes in hot water between each use. For patients using topical antifungals, apply to the infected area and the surrounding area for the full length of treatment. When treating for topical dermaphyte infections, such as ringworm, family members and pets should be checked and treated as well. Lastly, for fungi prevention, patients should keep skin clean and dry. Socks and underwear should be changed daily. Let your shoes dry out and make sure to wash them regularly. If you get nothing else out of this presentation, keep in mind these 3 take-home points. Number 1, Coke and acid help absorb, but for Zantac and Prilosec, you must warn. Number 2, it's not fungi. A lot of drugs interact with imidazoles. Check for drug reactions each time you prescribe. Number 3, fungi is not fungi. It's not fun for GI. Keep that in mind because patients will have a lot of GI distress and you need to know to accept that. So hopefully these 3 points will help you to be able to knock it out of the park next time.